It's another installment of extending Healthspan, starting with the next topic of just a general wellness and getting some better understanding of epigenetics and telomeres. We're going to review what Healthspan, disease span are defined as, the metrics for people that are concerned about watching their weight. And then dementia, of course, going to talk about as we get older, start worrying about the causes of dementia and some of the interventions that may help delay the onset, or potentially some people are thinking that may even reverse some of the signs of dementia. So again, here is Wilford Brimley and Tom Cruise. Wilford Brimley at 50 years of age is when he was acting in the movie Cocoon, and then Tom Cruise at age 56. So the difference in terms of one person aging faster, this is a good example comparing these two men. So one person has a health span that is shorter in duration than the other person. So is weight, that's a common question. Is it just the weight, someone's body fat, that is the main difference between these two individuals? Is it their, what is it that is specifically the difference that is shortening their telomeres? So we're going to take a closer look at weight. The measurements of weight, of course, are the body mass index, the waist circumference. I'm going to talk about the epigenetic changes in telomere shortening affected by weight. A BMI, or body mass index, uses two measurements. So it's the weight divided by the height. If it's in the metric unit, it's the kilogram divided by the height in meters squared. And these are used specifically for a public health approach to looking at weight throughout the United States and weight trends. So you can see that the BMI is increasing and is projected to be up to 50 BMI projected in 2030. So currently, almost 35% of Americans have a BMI over 30, which is where they define obesity, beginning with a BMI greater than 30. Again, this is a public health approach to look at populations. And they're looking at the proposed mechanisms that are increasing BMI throughout these large populations. And the proposed mechanisms are these that are listed. The ones with the larger arrows are the ones that have more of an impact. So genetics, epigenetics, and then they're looking at things like sleep, behavior. Notice how some of the things we think of, the major causes, we generally think of reduced physical activity as a major cause, but actually it's not near as important or impactful as things like behaviors, habits, and sleep deprivation. We look at the mortality rate in comparison to BMI. It's a J-shaped curve, meaning that there's a sweet spot right there at the bottom where the BMI is right around 21 to 24. It's kind of a narrow range. And then looking at all-cause mortality. So as the BMI drops, people get thinner and thinner. That also increases mortality rate. possibly due to reduced responsiveness of the immune system. And then on the other hand, is it increasing BMI, shown on the horizontal axis, increasing all-cause mortality with increasing BMI, felt to be due to an increase in inflammatory diseases. The flaws with using a BMI, it's only using two measurements, height and weight. And as you can see, two men standing on a scale, see that it does not take into account cardiovascular fitness, doesn't take into account the muscle mass, or the distribution of the adipose tissue. So it also misses gender. Women have a tendency to have more, or actually compared to a man in a healthy individual, needs to actually have more percent body fat than a man. And this is a classification system. As I was mentioning, pre-obese or being overweight is over 25, and then over 30 BMI is considered obese. And then it goes into the further classifications, 1, 2, 3 of obesity. So again, the sweet spot, 18.5 to 24.9 is a weight that's considered the best for lowering all-cause mortality. All right, so body fat, again, misses gender. And you can see that females tend to have more percent body fat, and it is necessary to maintain a good pregnancy. This would be considered the baby maker fat. That's what I like to call it. And again, with women having too high BMI, they start having menstrual problems, fertility disorders in both too high and too low body fat. So let's talk about telomeres. As you remember, the telomeres are the tips of the chromosomes that protect chromosomes through cell division. And when telomeres are looked at in comparison to BMI, this again is I should go back, this is a systematic review, meta-analysis, where they took 63 studies and they looked at telomere shortening in relation to BMI. What they found over this massive study of over 119 subjects is that many of these studies, 39 of those studies, showed weak or only moderate correlation between BMI and telomere length. So it's not just the BMI that's affecting telomere length. And the author's conclusion is it's not the BMI, it's the belly. It's actually visceral fat. So it's the distribution of fat that's affecting telomere length, not the total BMI. Visceral fat, as measured through waist circumference, is very inflammatory. So let's look more at what is causing the problem rather than the BMI. Look at where the potential inflammatory connection comes in. Visceral fat, the viscera are the organs. The viscera, the main viscera where you can actually measure is the viscera around the GI tract. So subcutaneous fat is superficial, but it's this visceral fat that's around the organs, including, it's also around kidneys, liver, heart. But this is where it can be measured, right around the abdomen. And it is considered metabolically active, which means that these cells, as they get distended, oversupply, outgrow their blood supply, start sending off inflammatory signals. And the specific pathophysiology of how this happens is that these fat cells, by this image, look at this image of a normal accumulation of adipocytes, outgrows its blood supply. And when some of the fat cells deep within start outgrowing the blood supply, they die, and they start to decay. They recruit macrophages, the white blood cells that clean up debris and dead tissue. And with the death of those, they excrete these inflammatory cytokines. And that's what starts developing insulin resistance and the inflammatory diseases of diabetes, cancer, and cardiovascular disease. So let's look at something that really does shorten telomeres and really does increase visceral adiposity. So let's look at when we stress about trying to lose that weight. So stress in and of itself increases visceral fat, and stress is more strongly linked to telomere shortening than BMI. This is a study showing how stress increases weight gain, increases visceral fat, which causes this vicious cycle. So stress predicts visceral fat over 18 months. The other problem with visceral fat is it starts increasing with aging. Sadly, due to lipoprotein lipase, which is a fat-storing enzyme. It gets stimulated after menopause and also by men as they start to lose testosterone. Cortisol increases, and this unopposed lipoprotein lipase causes an increase in visceral fat. So question, after COVID-19, what is the leading cause of death in the United States today? Accidents, cancer, heart disease, or stroke? So I guess what you could say within a total population, the answer is heart disease. So if you live long enough, even if you've been active your entire life, it's that unopposed lipoprotein lipase that eventually you will die of either a heart attack or cancer, statistically. So metabolic diseases from inflammation are the leading cause of death in the United States today. So rather than our focusing on weight loss, we have to focus on reducing the inflammatory factors that cause cardiovascular disease, cancer, and looking through epigenetic modifications and telomere lengthening. And these can be done through looking at studies with interventions, both within animals and humans. The external forces that are influencing the expression of genetic codes, which is the definition of epigenetics, include activity, food timing, stress levels, and of course, sleep. So epigenetics, remember, DNA can't be changed, but the expression of the genes within the DNA can be altered. So I like this next one, where you might have the bad guy, the genetic code inside that's just waiting to get out. And you can suppress that through lifestyle interventions. This is an example of one of those genes. It's called the thrifty genes, KLF14, that contributes to body fat. So if you can have the type of lifestyle that can suppress the expression of that gene, you can maintain a healthy BMI and reduced visceral fat. This is an interesting study, and it's considered a pilot study. So it's one of these case series that's interesting, that you would look at and consider. It's interesting and incorporate that into a more robust trial with randomized controlled trials, for instance. And what he'd done is taken 10 patients with documented dementia and Alzheimer's disease, and he used a multimodal treatment approach, a very aggressive lifestyle intervention that was particularly suited to each individual circumstances. What they found is 9 out of 10 of these individuals had reversal of their dementia. One who did not had very profound Alzheimer's disease, who died. And the interesting thing about this multimodal treatment approach was that in addition to their dementia, it was noted that all subjects lost excess body fat. And this, let's just go through a little bit more about that. And one of the case examples is a 67-year-old woman who was a data analyst. She quit her job when she started being able to forget number sequences. So she was diagnosed as developing progressive dementia, and her mother had died from dementia. And so she was contemplating suicide. And her friend talked her into enrolling in this study before she pulled the trigger, for instance. All right, so this is her personalized intervention program. So the diet, for her specifically, they eliminated simple carbs, gluten, processed foods. She was only sleeping 4 to 5 hours per night, and they increased that to 8 hours per night. She was placed on a fasting program, a 12-hour fast, which is referred to as a circadian fast. So nothing after dinner and 12 hours before breakfast. She had a stress reduction program. She was put on meditation and yoga twice a day. And she actually became a yoga instructor, by the way. And then supplements were chosen based on her blood work. She started on vitamin D, B12 fish oil, and CoQ10. Her exercise was a moderate amount of exercise, 30 minutes a day, 4 to 6 days per week. So within a few weeks, she had reversal of her dementia. She did return to work, and she had a 20-pound weight loss. And this, by the way, is without caloric restriction. There were no calorie counting. There was no attempt to focus on the weight loss. It was mainly focusing on these lifestyle interventions. So in a 6-year follow-up, she still works. She continues with her lifestyle plan. So the author's conclusion was that wellness is achieved through these lifestyle changes, and the perfect weight follows. So we need to look at the lifestyle interventions that can affect epigenetics, telomere shortening, and not on the scale. So this is his current work where he's, since 2014, he's been including over 3,000 participants in these lifestyle interventions. Around the world, other researchers have considered how lifestyle impacts dementia. So it began within the Finnish geriatric intervention study, and the acronym is the FINGER study, was using a multimodal lifestyle using randomized controlled trial intervention program. And throughout that, it's initiated a worldwide programs. And these are the different dementia programs that are going on throughout China, Europe, Korea, Spain, Canada, all the way to India. And these are organized programs where they're sharing data and using this more of a randomized controlled trial. So let's look at the rationale behind each of these interventions. So the diet, the main thing we talked about was systemic inflammation. So reducing simple carbs, we can reduce elevated blood sugar levels, and elevated blood glucose increases the inflammatory cytokines. And by changing the food types, reducing simple carbs helps to prevent insulin resistance, and in turn reduces inflammation not only throughout the body but also the brain. The stress reduction, the main culprit is the sustained levels of cortisol, the stress hormone released by the adrenal gland. So with stress, it increases cortisol, which in turn increases insulin resistance and causes also leptin resistance. Leptin is the satiety hormone. So you never feel full when you're under a lot of stress. It also decreases the metabolism. So even though you reduce the amount of calories, you still, you become more sluggish, metabolism slows down. And so all this results in added weight gain. Sleep, the goal of improved quality of sleep is prevention of these beta amyloid plaques. And beta amyloid develops in the brain every single day naturally as a protective mechanism. But at night, during deep sleep, the brain has this extraordinary system called the glymphatic system that clears out metabolic waste, including beta amyloid. And it's only during one specific period during deep sleep, or it's also called NREM or NREM sleep, the very deep sleep, that the cells shrink and the CSF flows between the cells, and metabolic waste, including this beta amyloid, is reduced. Fasting. Fasting was another one. We talked about her. Fast was called a circadian fast. And that is an attempt to clean up old cells. When you get into a state of fasting, autophagy begins, where it's self-eating, weeding out the old damaged cells and allowing regeneration of better cells. The supplements is based on nutritional deficiencies, also based on things like age, and age is responsible for reducing melatonin secretion. So a younger person may not necessarily need melatonin. Melatonin initiates sleep, but with aging, melatonin secretion is reduced. So melatonin may be a good supplement for improving sleep quality. And of course, exercise, the best anti-inflammatory you can do. People think of all these anti-inflammatory foods or anti-inflammatory supplements, but of all those things, the best is exercise. Exercising muscle releases myokines. Now they're cytokines, but they're anti-inflammatory cytokines. So they improve your leptin sensitivity, so it reduces your appetite. Now, there's one caveat with that is if you maintain moderate exercise. High exercise increases the appetite. So high intensity exercise will increase appetite, increasing your body's recognizing that you need an increased caloric need. At any rate, so moderate exercise is the key word for people who are trying to get to this point of getting to a good BMI. So in summary, we talked about BMI, how it's used, talked about how stress, particularly stressing about weight loss, is hard on trying to reduce your visceral fat, and also increasing cortisol. And in, summary, it just actually increases the weight, increases appetite, increases insulin resistance. We talked about epigenetics. So the lifestyle factors are having an effect on the epigenetics and the telomeres. And then we're talking about all the wellness factors, and that's what we'll get into with each of the chapters. So do you remember you have a US Marine who is cited for having a too high of a BMI? So how is this measurement flawed when considering an individual? So basically, BMI does not take into account muscle mass, doesn't take into account the location of adipose deposition. So BMI, in summary, is great for population studies, for public health approach. It's low cost. It's a good starting measurement, but it's not designed for individual patient care. So the low-cost measurement that is the best for a screening tool, inexpensive, is, of course, the waist, doing a waist measurement. And for men, abdominal obesity, this is at risk greater than 40 inches, or women greater than 35 inches. And again, with talking about visceral fat, so healthy subcutaneous obesity, is considered healthy adipose tissue. It's no ectopic fat, which is around the viscera, and there's a normal metabolic profile. And this is in contrast to visceral obesity, which is dysfunctional adipose tissue. And then you start seeing visceral fat in the liver, around the heart muscle, and you start seeing this altered metabolic profile. And the result is that visceral obesity causes this inflammatory release of cytokines and inflammation. And then, of course, the inflammatory diseases are responsible for telomere shortening, which is accelerated aging of the cells, and then all the diseases of aging. So visceral obesity is one example that causes telomere shortening, but the other causes, of course, that we'll talk about in more detail include stress, certain food types, toxins in the environment, sleep deprivation, and several more that we'll get into. So these are the 6 factors that increase inflammation. Of course, sleep deprivation, sedentary lifestyle, toxins, late night eating, stress, and ultra processed foods. Things that reduce inflammation, quality sleep. So it's not only how long you sleep, it's the quality of that sleep. Exercise, unprocessed foods, meditation or stress reducing interventions, intermittent fasting to allow for autophagy, and then supplements or vitamins if they're lacking in the diet. So who has time to incorporate all these into their busy lives? Well, let's look at one person who has been very successful in his life, and he does incorporate all of these factors into his lifestyle, Tom Brady. So his meals include a 80-20 plant to animal diet, lots and lots of green leafy vegetables. He does use a circadian 12-hour fasting. He gets high quality sleep. And this says 200 pajamas, but it's meant to say $200 pajamas, special pajamas for sleeping. He has a bedtime routine. And this is his, I got off the internet. This is his usual sleep schedule. So notice it's here, especially taking time for family and always ready, preparing for sleep, 8:30 at night. So true or false, only calorically restricted dieting is needed to reduce weight. If there's anything you learn through these presentations, is that calorically restricted dieting is not a good way to lose weight. So wellness is a balance of all of these factors that influences the self. So in the next classes, we're going to be talking about brain hormones, the eating and satiety, the mechanisms, talk about picking out a potential topic. I'm going to help you find resources to locate scientific evidence very easily, and start creating a file in the Google Drive with a shared folder so that we can work on preparing this book together. Any questions? Please contact me through my Virginia Tech email address. And I thank you.